To our special program, The Chat Room with me, Li Zhao, coming to you live from China's capital, Beijing. You're now watching us live on CGTN, China Global Television Network. And our topics today are going to be the current state of COVID-19 situation in China after the country announced relaxation of COVID control measures very recently. We're going to talk about how the country is working to ensure the timely and efficient treatment of severe cases, and also how to protect the vulnerable, including seniors, kids, pregnant ladies, and those with chronic health conditions. Now, China eased its COVID-19 restriction control measures earlier this month. That's a major shift from its dynamic zero COVID policy after officials found the Omicron variants to be less severe, despite more contagious. The country will also downgrade COVID from Class A infectious disease to Class B, starting from January 8th next year, which is just days away. And also they renamed the Chinese term for COVID from novel coronavirus pneumonia to novel coronavirus infection. Authorities will also drop quarantine measures against people infected with novel coronavirus and stop identifying those close contacts and designating high risk and low risk areas. All right, that's enough about our background information. Before we dive into our topics today, let me first introduce our guests today. Let's start from the ladies first. There are two ladies, both from the second affiliated hospital at Zhejiang University School of Medicine. First, we have Ms. Tong Yuling. She's Associate Chief Physician and also Vice Chair at Department of General Practice at the second affiliated hospital of Zhejiang University School of Medicine. Welcome, Ms. Tong. And also Ms. Ren. Hello, and also Ms. Ren Reng. She's Associate Chief Physician at Department of Critical Care Medicine, also at the second affiliated hospital at Zhejiang University School of Medicine. Ms. Ren, do you want to say hi to our audience also?
Sure, thank you for having me. Hi, everyone. I'm really glad to join you.
All right, and our gentleman right here, he's Mr. Guo Fan. He's attending physician at Department of Cardiology at Peking Union Medical College Hospital. Welcome, Mr. Guo.
Hi, everyone.
Yeah, Mr. Guo is joining us live from Beijing, right? And two ladies are joining us in Zhejiang. Now, I mentioned in the intro, now China has seen an unprecedented wave of coronavirus after the relaxation of the restriction. Some people call it COVID tsunami. I got caught in the tsunami as well. I don't know if you guys can tell. I still have a little bit of lingering throat problems, but I'm among the mild cases. But there are a lot of people, especially elder folks or those who have chronic health conditions. They may choose to go to the hospital. They are more with the critical side. So let me start by asking all three of you, what is your everyday work looking like right now? Have you caught COVID yet? Let's start from Dr. Tong first.
Okay. For us, I should say that I got the COVID last Wednesday, so I just recovered.
Last Wednesday.
Yes. Our team, even for our general practitioners, because our hospital has 5 branches, and for our GP, we have all the OPD in every branches. And we also have wards work in 3 branches in our hospital. So we still need to continue to meet all the patients' needs. And we also have the responsibility to teach and guide the community doctors, because for our GP we have this responsibility to guide the maybe some problems with the community problems. And besides this work, and lots of our colleagues has been transferred to join the fever clinic, the ER, and the intensive care teams like the Dr. Len's team. And also this week we have took over step down wards. Step one, where the patients will have been transferred out of the ICU, but they are medically admissible to the general ward. Then we will take care of them. So this is our work for these days.
So how you mentioned step down, can you elaborate on that? What do you mean by step down? So does that mean that critically ill patients and then they may be turned into a better condition and then transferred to your area?
The step down is the bridge connected the ICU to the general ward.
Okay.
Okay, because like maybe some patients with the multiple trauma, he has got the how to say, the tracheal incubation out, but he can't go to the general ward because it's really severe. So that's it. That we can take care of them in the step down ward.
Okay.
Okay.
Got it. So what about you, Dr. Ren? What is your everyday work looking like?
All right. Again, I want to start with thank you for having me today. And I'm honored to work with Dr. Tong's team together. I am a physician, as introduced. I'm a physician in critical care medicine, and my specialty is neurointensive care. Right now, actually, I just ended up with a 24 hours duty yesterday and just got back to the office right now. For now, I'm working one of the 5 branches. So we all set up the different ICU ward and ICU team in all 5 of the branches. Right now, I was working in one of them. And actually, I would like to introduce my daily work into 3 parts. One is what we call the daily routine, just to manage the patient who admitted to the ICU. And frankly speaking, yes, as a tertiary hospital ICU, we are admitting more and more the elderly patient with COVID infected. And many of them will have the underlying diseases and chronic disease. But the second part, I think the most important one is we, the ICU doctors, have to take over a lot of consultations from the inpatient ward. I mean, we wanted to optimize the process to screening out the high risk factors for the patient who might have the progression. So we will do a lot of consultation every day and to visit individual patient who might have the high risk for the progression. And the third part would be the faculty training, because we're expanding the ICU beds. So that means we need more fellows, we need more the nurses, so we have to work as a whole. So we, the ICU doctors, will do some faculty training every day. So basically, there were things that we did in the recent days. Thank you.
So you said you just spent 24 hours in the ICU last night. So how many patients did you treat last night?
Well, during the midnight, I would say 3, but during the daytime, like the 4 to 5, so and putting together around 8 to 10. And I also got like the dozens of the consultation, as I mentioned before. So you temporarily, you're gonna go outside the ICU wards and go into the inpatient ward for the consultation.
So 8 to 10, is that an increase before COVID compared to the time when COVID does not like go as this big? Did you see an increase of patients? Yeah,
I would
so
say
normally
yes.
How many patients would that be for a night?
Well, actually, because of the branches right now, I was working is kind of somehow the newly opened campus, newly opened ICU. So usually we just less than 10 patients.
Okay.
But right now we just, the double. But anyway, the frontline would be the fever clinic and emergency department. So we're really working as a whole. Everybody's so busy.
Because you're working with ICU, a lot of the patients you treated are very severe, or with very severe symptoms or pneumonia symptoms. Are you concerned about your own safety?
Well, I don't mind to sharing some of my experiences with the audience and the public, because I just got COVID like 1 week ago when I was on duty. And I think I would probably diagnose myself as a mild symptomatic patient because I got a high fever, sore throat, and runny nose, and so on. But right now, luckily, I got a full recovery. Since I've got infected, actually, I don't worry about that being infected again, let's say in the kind of the short period, like in the next 3 to 6 months. But compared to worried about myself, I was more concerned about my colleagues. Because we're worried about that we'll run out the human resources. So in this case, I'd rather just to stay at home and just protect myself and protect my colleagues. Yeah.
So a big salute to you guys. You guys are the real hero. All right, let's go to Dr. Guo right now. Tell us about your everyday work. I know you actually joined the fight in Wuhan 3 years ago. Right, so you're one of those frontline doctors, and right now you're working in Beijing, and Beijing has seen a big surge of COVID patients. What is your everyday work looking like right now?
Hi, hosts and hi, audiences. I'm really glad to be here, and I'm a cardiologist and mainly responsible for the admission of patients to the general ward of cardiology in our hospital. But actually, in the past 7 days, a total of 21 patients have been admitted to our ward, and 16 of them are kind of severe COVID-19 cases with pneumonia and complicated with cardiovascular conditions such as heart failure, coronary artery diseases, hypertension, hyperlipidemia, and something like that. And that's my everyday work.
So we know that you actually joined our discussion like 3 years ago when we have a temporary studio in Wuhan back then, and I remember watching you like talk with some of the experts from Israel. I don't know if you remember that as well. What is Omicron that you saw I guess less severe than 3 years ago?
Yes, I think the Omicron variant is much milder than the original strain, of course. And we've seen a lot of severe cases back in Wuhan, but nowadays we can treat these patients in the general ward. We might not transfer the patients to the intensive care unit.
So most of the prevalent variants are Omicron variants, right?
Yes, I think so. Of course, although I'm not a specialist in virology, but a lot of updated information can be found from reliable sources out there. So I think according to the data provided by China CDC, the main strain or the dominant strains are still Omicron strains.
So will they mutate again? I guess in a short period of time. Of course, they will mutate in the future.
Yes, of course. We are talking about viruses, right? They are mutating all the time. But at this moment in December, we are still having these Omicron strains circulating in the communities, and all of these strains were imported to China from overseas and not from mutations or from recombinations.
Got it. So I think we've sort of talk about this, but what are some of the, I guess, common symptoms of recent COVID cases? I mentioned there are pneumonia-like symptoms. What else? Like what other symptoms have you seen in your patients?
Yes, actually, I don't think the pneumonia is the common complications of this Omicron strain.
Oh, really? So what is the common one?
The common symptoms, I think everyone has in this studio have all experienced. The common symptoms, I think, are fever or chills, are the pain everywhere in the body, including sore throat, muscle pain, body pain, pain everywhere, and we have a lot of cough, right?
A lot of cough, sometimes running nose.
Running nose, stuffy nose. Maybe loss of taste or loss of smell.
Yeah, for sure. Those are some of the very common. Anything you guys want to add on, Dr. Tong and Dr. Ren?
Many people just suffer from the fever and the cough. Yes, and I suffer the severe muscle pain. Yeah. Muscle pain in my back, and someone maybe have some diarrhea or vomiting, some GI problems.
Diarrhea, for sure.
And some decrease the sense of smell and taste. Yes.
Those are some of the common symptoms, and what we call those are mild to asymptomatic cases, right? Those are not the severe cases. So, which symptoms suggest that it's time to go see a doctor, Ms. Ren?
Well, could I just add a little comment for the previous question?
Oh, sure.
Because I just have a remind for the elderly population.
Okay. I can talk
But
about
Go
this
ahead,
part.
Dr. Ren.
Yeah.
Okay, I just want to just add one more kind just for the elderly population. As the two doctors, Dr. Tong and Dr. Guo mentioned, some of the adult patient will have kind of severe response of the body, like the fever, like the chills. But I just wanted to remind that if you have some elderly population back at home, their symptoms may not as typical as the younger populations. In this case, I mean, you better watch out their mental status, whether they just feel drowsiness or sleepy. Sometimes they don't even have the strong reaction of the high fever, of the high body temperature. They just lost their, they just lost their appetite. They don't want to eat any food, take any drink. And sometimes they look not that activated as normal. So, I mean, temperature is crucial. And I think the majority of the people will suffer from the high temperature and the chills, but especially for the elderly patient. I mean, we better watch out other than other symptoms, right? Like the drowsiness, sleepy, and poor mental status. So that is my kind of remind, yeah.
So those are may also be the symptoms for elderly patients. I heard that you have a special equipment that can help us to better detect, or should I use the word detect, this kind of service. Can you show it to us?
Actually, I'm sorry, I didn't bring the kind of devices or equipment with me back at home, but I do have, I think that a lot of audience inside of screen might feel familiar with that. That is to say that is a sport watch or the sports bracelet. A lot of people have the, used to go to the gym, they wear the bracelets and just monitor their heart rate. And nowadays, there is some kind of sports watch can monitor your blood oxygen saturation as well. So this is sometimes we differentiated the patient from the mild to moderate or to the severe cases. So we just based on, of course, we have different criteria, but the oxygen saturation is one of the very important and crucial criteria that we use. So if you happen to have such equipment or devices around you back at home, maybe you can just put it down and just to monitor your own heart rate and the oxygen saturation. And the number is easy to remember. I would say if you happen to have the number lower than 90%, or let's say persistently lower than 92%, maybe you will take it into the consideration that whether you need to go to the hospital for the closer monitor. And for the patient, like the elderly population that used to have some underlying diseases for the COPD or fibrosis in the lungs, they may also already have such devices. Now it's time for you to use it. Yeah.
So I think any device that essentially can detect or to monitor your heart rate or the blood oxygen saturation that people can use, not specific devices that we have to purchase it, anything that can really trace those numbers.
Sure.
I mentioned that Beijing has seen an unprecedented wave of COVID infections. I guess that's pretty much similar across the country as the country has announced the relaxation. Just it's something that across the country. So tell us the COVID state in Zhejiang right now, ladies.
Well, I think I may take the question first. Actually, according to the public media press conference by the Zhejiang government or by the Zhejiang Health Commission, we got the data that maybe the peak patient surge will come earlier, a little bit earlier than we expected. So maybe around the early January. So that is the data, the public data that we can get. And another data is about the peak surge is about we might have 1 to 2 million new confirmed cases every day. So that is huge. And according to the national regulations, all of the tertiary hospitals have to prepare at least 8% of your total hospital beds and to transfer to ICU beds. So I
as a result of these, in my hospital, a second affiliate hospital of Zhejiang University, we have already transferred at least 300 ICU beds for now. And also, because we have the 5 main hospital branches around the city, so we all set up the ICU ward and ICU team accordingly. And something we did prepare for that, other than the beds, would be the doctors and nurses. That is human resources per se. So as I mentioned before, we trained a lot of fellows doctors to join us. Some of them are from neurology, neurosurgery, cardiology, respiratory, rheumatology, and so on. And we were updated with all of our colleagues with the latest policy changes. And we will also make sure that we will follow the same expert consensus to maintain the medical quality. And also, I think by the help of the hospital, I feel confident that we have enough devices and equipment. And one thing I want to mention is our step down ward. And this time, maybe this question will hand it over to Dr. Tong, because their geriatrician, the GP is taken over of the step down ward. Dr. Tong?
Yeah, the step down wards, we have opened 2 step down wards in 2 branches. Yeah, and besides this, we expanded the ICU ward, the step down ward, the ER room, the emergency room, and the fever clinic. This week, we also opened a respiratory specialist clinic from 8 a.m. to 12 p.m. to serve these mild patients and leaving the emergency room resources for the severe patients. So that is we have done all these workers to prepare. Yes.
As you guys are both saying, so right now Zhejiang is requiring 4% of requirement of ICU beds and another 4% for backups. And also Ms. Tong stepped down site. What about in Beijing right now, Dr. Guo? We've seen some of the long lines waiting in front of the hospitals. Do we still expect the long lines right now, Dr. Guo?
Yes, probably. I think in the future, 1 or 2 weeks, there may be still a lot of patients are going to the emergency room or the fever clinic. And so we are still facing a lot of challenges to treat these patients in Beijing.
Yeah. And also in Beijing, we see a lot of the actual seniors waiting in lines. As I mentioned, a lot of them are experiencing underlying or chronic health conditions. How should we protect those so-called the vulnerable, like the seniors, like the kids, and also pregnant ladies and those with chronic health conditions? Dr. Guo.
Yes, for these vulnerables, we think I think the severity of the disease of the COVID-19 is correlated with your immune system and the virus's load that you are contacting. So the first thing you can do is to, if by any chance you should get the vaccination as soon as possible if you haven't contracted COVID-19. And secondly, you should protect yourself from getting these viruses, such as you should wear N95 masks, or washing your hands very frequently. And also you should keep a window open to keep the ventilation in the room. So I think these are the basic rules for the infectious diseases.
So we know that the Spring Festival, which is one of the largest holidays here in China, millions will be traveling around the country. So what are some prevention measures that you would like to suggest to those who haven't contracted COVID, specifically, as I said, those vulnerables? Let's start from Dr. Tong first.
Okay. So the Spring Festival, we will have a big travel. And during the travel, first, we should still take some measures to protect ourselves, whether you have got the COVID or not. because the winter is also the season for respiratory diseases like the flu. So we still have to protect ourselves during the travel. Before the traveling, first make a plan. If possible, we just suggest self-driving, not take the public transport. If you have to take the public transport, we suggest that wear the mask all the times. Don't remove the mask even when coughing or sneezing. And we have to keep the social distancing, especially when you're waiting in line, and keep our hands clean. You can bring some alcohol wipes just in case. And if the travel is a short trip, avoid meals. Then you don't have to take off your mask. If you need to eat or drink, try to separate time from your neighbor. Just that mean to keep your neighbors that you do drink, but your neighbors not drink. So one of you can wear your mask. And another tips is when you arrive your home, change the mask at the door. So you have to prepare 2 masks at least, and wash your hands and face, and then change your clothes if possible. So you during the travel, you protect yourself, and when you go home, you have to protect your families. Yes.
So that's something I also want to ask, because we have a lot of people contracted with the virus and they think they're safe for this period of time, but they still have family members, right? Some of them may not have contracted with the virus yet. So Dr. Ren, tell us how should, what kind of protective measures should we do to protect people around us?
Yeah, I think it's a really important and great question. Actually, I believe that most of us has been a while that we didn't meet with our relatives. So we must miss them very much. So fully understand that there's a kind of need for us to travel during the Spring Festival holiday. But also, I just wanted to remind that it's also our responsibility to look after the vulnerable populations that we mentioned before, right? The elderly, the patient with underlying diseases, the pregnant ladies, the newborns, and etc. Well, I might have some tips. The first thing is to make sure that you are in a good condition before you pay a visit to your relatives, especially you knew that there was someone like the elderly, your grandma and grandpa, who used to live alone. And during the Spring Festival, it would be very happy to meet you again, but make sure that yourself is in a good health condition is rule number 1. And number 2 is if you don't have, or they don't have the contraindication, as Dr. Guo mentioned, if they don't have the contraindications, make sure that they can get a vaccination as the boost vaccination as well as soon as possible. I think it's a good way to protect themselves and protect you as well. And third thing is, it's better for you to make a medical list. I mean, just to get to know before you leave, check with the status of your destiny. Do they still in a very high patient volume, or do they in the public health burden or not? Once you got caught, or once you are, let's say, your relative got caught, make sure that you have something which is safe and convenient to drop by. So that is my suggestions.
So as protective measures, some of the people may be preparing for antiviral drugs. Especially China has granted approval for some small molecule antiviral drugs like Pfizer's Paxlovid. So although it's still a prescribed drug, it requires a doctor's prescription. Tell us what kind of patients need this kind of drug. Let's go from Dr. Guo. What kind of patients need Paxlovid? Does everybody need it? If I'm suffering just mild to moderate condition, do I need it?
Yes, I think the first thing is some antiviral drugs are just for the early onset of the disease. So if the duration of the symptoms has been over like 5 days, then the antiviral drugs will not be useful for you to prevent from severe cases. So timing is very important to take these medications. And the second thing is that the antiviral drugs should be used only in these patients with high risks, such as the elderly patients and the patients with several comorbidities, such as diabetes, obesity, and or hypertension, cardiovascular conditions. So these patients are more vulnerable. So antiviral drugs could be prescribed to these patients.
So Dr. Guo just mentioned that this kind of drugs are better for those who have high risk or severe symptoms. Now, let's go to Dr. Tong. Is it safe for people just go anywhere, not one of those medical institutions to get this kind of small molecule drugs?
Sorry, pardon.
Is it safe for people to just get it anywhere, but not from a medical institution for those small molecule drugs? Antiviral drugs?
No, of course not. How to say?
Well,
I
mean,
yes, Dr. Ren, please.
Yeah, actually, I just wanted to, on behalf of myself, so it's kind of my personal opinion, just to share and to discuss with you. First of all, I believe the oral antivirus agent or the monoclonal antibodies that we saw a lot of discussions on the social media. And we knew that there's some very good result for the research article published on the major journal. So by interpreting this kind of good result, everybody seems like, well, the drug is overwhelming to the vaccination. But the first, it is a prescription drug. By saying so, that means that you need to have the prescription to buy it, to take it, and to use it under the surveillance of the medical professionals. I think for me, just on behalf of myself, it is a rule number one. And number two is, as Dr. Guo mentioned, the timing is very important. So in short, one sentence for the indication of this kind of oral antivirus agent, we use it to the very early onset of the COVID-19, early within the 5 days, and we use it for the mild to moderate COVID-19 confirmed cases, but at the high risk of the progression to the severe diseases. So the indication of how to use, when to use, who to use this, all of other problems needs to be discussed with the medical professions. So just on behalf of myself, I strongly suggest to you that to take it under surveillance and ask for your doctor's advice. Because you know what? I knew that some people will have this kind of oral antivirus agent back at home, prepared for their elderly relatives back at home. But don't forget that they also have some chronic disease background. Like Dr. Guo mentioned, they may have the hypertension, hyperlipidemia, the chronic heart disease. So they may take like the anticoagulation agent, the antiplatelet agent. So these kind of the drug, when they taken together, they might have some kind of the side effect. So it's not that a simple way. So obviously it's not, for me, it's not proper to use it very randomly. Yeah.
Absolutely. It is still a prescription. It's still a drug that requires doctor's prescription right now here in China. So let me remind those who are watching our live stream right now, do not just panic buying. A lot of times you don't know what your condition is. So you need to go to a doctor and decide whether you need to take this drug or not, or your family members. All right, so let me remind you, we're now broadcasting live on CGTN, China Global Television Network. You can watch us live on YouTube, Twitter, Facebook, and also China's Weibo and also WeChat platforms. And leave us comments if you have any questions for our three doctors. And we actually got some comments already, and they have some of them are comments and some of them are questions. So we got a question from QD on YouTube, and he asked, or he said, all the best to Chinese peoples and around the world, being unifying together, and take care of yourself. Thank you, QD. And also Grace Jiao, she's also on YouTube, and she said, wish people can be safely past this dark time. And also we got a question, and this person asked, why am I coughing? I'm already fully recovered. Can anybody take this question? Let's go to Dr. Guo. Why is she still coughing after like several days when she thinks she's fully recovered?
Okay, coughing is a self-protection mechanism, which is provided by your immune system and your lungs. So even if your body has already, removed all these virals, but they still want to defend themselves. So you are keeping coughing all the time, and for these patients always coughing, I would say you could just use some coughing syrups or something sweet, like honey water. Honey water may relieve the coughing. It will be very useful. And if you do not have honey, I don't think so. But if you do not have honey, you can use some other sweet things. Like in Chinese, we say 冰糖雪梨汤.
Pear soup.
This can be very useful, I think. But if you keep cough like for more than 3 or 4 weeks, then you probably should go to the hospital and to check to do some CT scan of your lung to see if there is a pneumonia there.
Again, we want to remind everybody, because different people have different symptoms. If your symptoms last longer or a bit severe than other people has described, you make sure you go to see your doctor. All right, the same question. Let's go to Ms. Ren. So besides, drinking more honey water or pear soup, what else do you suggest people do? Can they exercise?
Oh, why not? I mean, I'm kind of person who is really I want to stay positive. Even, I got cold during the last week. But I would definitely say that if you just recovery from the COVID-19, you'd better have the good rest. But it doesn't mean that you have to stay still. I mean, you don't have to lie in your bed for the whole day. Of course, you can have some kind of the normal social activity, right? Doing some exercises at home and try to a little bit speed up your heart rate back to your normal status. But do not go to gym, right? At least within the 2 to 3 weeks. I know a lot of the healthy adults wish to go back to the gym as usual, but just watch out. You better watch out because you may run out. And that's number one. And number two, that's for the elderly population. Sorry, I have to mention this, very vulnerable population for several times. Yeah, they may feel kind of sleepy and do not have the appetite. Just, try to help you to eat as much as proteins as you can. And for myself, the nutrition support is very important during this kind of phase. I believe that Dr. Guo and Dr. Tong, they might have the same kind of opinion that nutrition support at this stage is very important. Drinking some warm water and keeping the room air refreshing is also very important. Yeah.
Dr. Tung, do you have anything to add on besides just drink more water and get good rest, like Dr. Ren said? Do you have anything else to add on?
Yeah, I agree with Dr. Ren's opinion. I think is we should take more high quality proteins like the eggs, milk, fish, like this one, and just drink more water. And I just say I have another opinion that I don't suggest to take intensive exercise in the beginning 2 weeks. Yes.
beginning 2
Still
weeks.
have some cough, sorry.
Yeah.
Because I still feel wheezing after climbing 2 flights of the stairs these days, but I can jog 5 kilometers before. So everyone, most of the people will experience the decrease in cardiorespiratory endurance after infection. So we just suggest to take some light physical activity in the first 1 to 2 weeks after the infection, such as like wash some dishes, but not to take the cleanup, and some take a short walk, and some watering the flowers, just like this, and gradually to increase the intensity of the exercise. If you want to go to the gym or just return to the level of the pre-infection levels of the exercise, I would suggest that after 1 month, then you can take this level exercise.
Okay.
That's our suggestion, yes.
Thank you, Dr. Tong. I can tell you want to cough there. So we all want to cough. It's as we said, is one of the common symptoms of post-COVID patient, right? But also make sure, as we said, if you cough for a little bit longer or your symptoms are a little bit severe than other people has described, make sure you go to see your doctor. So we also have another comment from our WeChat platform, and this person asked, so my PCR test is right now negative, but I feel like my heart beats faster than normal. Is that a symptom as well? Let's go to Dr. Guo. Is that a normal thing?
Yes, sure. I think almost everybody will experience, heart pounding or, fast heartbeats after the COVID-19. And it is might because of your body is trying to get recovery, and but we have this formula to calculate the maximum heart rate for a healthy individual. That is 220 minus your age. Take me for an example. I'm now 35 years old. So my maximum heart rate would be 185. And generally speaking, our heart rate will be like 50% to 70% of our maximum heart rate. Our normal heart rate will be 50 to 70% of our maximum heart rate. So if your heart rate is always over this upper limit, and then you probably should go to see the doctor.
Okay, so Dr. Guo just gave us some math to do. So you use 200 minus your age. I'm not gonna say how old I'm, but anyways, 200 minus 220 minus your age, and then the normal heartbeat should be around 50% to 70% to this number, right? Okay.
Yes.
Got it. Now let's get back to our discussion. China right now, we see the majority of people, they're experiencing mild to asymptomatic symptoms, but the country's focus right now is really to cure those severe illness. As I said, most of the severe illness are taking place in elderly people or those who are with underlying or chronic health conditions. So Dr. Ren, let me ask you, what are some of the measures or some of the ways that we can detect if the elderly, I know you started to talk about this already with the heart rates and also with blood oxygen saturation device. What are the other ways can we detect if those elderly folks have have symptoms, or they should immediately go to the hospitals?
Yeah, thank you for the question. I will start it by, it's better for you to getting to know the basic condition of the elderly population. Or take me, for example, if I live with my grandma, I should get to know her basic condition. What is a basic heart rate? What is a basic blood pressure? What is the basic respiratory patterns look like? Because as I mentioned before, sometimes the elderly person cannot
have the strong enough body responsiveness to the COVID-19 infection. So other than the temperature, we need some other parameters to help us to tell the severity of the true situation. And besides, if you have the extra like the equipment devices, as I talked before, like the oxygen oximetry, that's a very simple clip just to clamp on your finger.
Yeah.
And that would be better for you just to have detection of your oxygen saturation. But there were some other symptoms that you need to, pay attention. One is a tachycardia, which is doctor mentioned before, that is really fast, beating fast of the heart. But sometimes for the elderly person, they may lose of their appetite. So during the infection phases, they may cannot take enough like the water intake or the food intake. But for the people who have the diabetes before, and if you are using the insulin before, right? For now, they don't eat enough food. They will have the dizziness and they will have the tachycardia. I mean, not only the elderly person be sent to the hospital because of the COVID-19 infection, sometimes they will have the newly onset of the other, like the acute diseases. For now, it is a winter time, right? For us, because my major was neurointensive care, so I'm dealing with a lot of stroke patient. If at this time, right, with the painful stimuli, or if you do not have a good blood pressure control, you may feel sudden attack of the numbness on your face, paralysis of one of your limbs. That might also an indication that you might have the newly onset of the stroke. And this time, don't hesitate, just go to the emergency department for the check. That's number 2. And number 3, that once you're not feeling well, because right now we're following the one rule that we will hospitalize the patient whenever needed. So especially for the vulnerable population, if you are not feeling right. So don't hesitate and just go to the hospital for the closer monitoring.
As Mr. said, China right now is really pushing for this mechanism called classified treatment. So if you're with the vulnerable, meaning if you're seniors, if you're young kids, you're pregnant ladies, or you're someone with underlying health conditions, you can directly go to, let's say, second tier or third tier hospitals, or maybe transfer to first tier hospital if needed. But if you're with, not so severe conditions, you can go to your community level clinics and ask the doctors there for help. So right now we're calling this mechanism classified treatment. All right, Dr. Guo, I think Dr. Ren talked a lot about how to detect severe cases. Can you tell us if someone is not at that severe cases, any poses at home that can help them?
Yes, I think so. And some of the patients might go to the hospital and get a CT scan of their lungs, and they find some patches in their lungs. That means they are having pneumonia. But the pneumonia is not so severe that their oxygen saturation is not below 90%. So they might be some very mild cases of COVID-19. And during that time, my suggestion will be just trying to lie on your stomach back at home, because
upside down. Instead of sleeping on your back, you turn upside down.
Yes, that's right. Lie on your stomach, and we call it prone position. Prone position is very, very useful to prevent severe cases. And it will stimulate the sputum to come out, and it can help to improve your lung status, and it's kind of very useful. And I think Dr. Ren might have some comments on prone position, because they could use this position for almost every severe cases.
Prone position, very useful. Dr. Ren, you have anything to add on about prone position?
Actually, I think Dr. Guo gives us a really good example of showing how to lie on your stomach. And as he mentioned, we just prescribe the prone position for nearly every intensive care patient in ICU. But for the general population, I don't want to, induce a kind of the panic emotion. So as Dr. Guo introduced, if you afraid of your oxygenation back at home, you can just simply, lie on your stomach, and that's enough. Yeah.
We've been seeing this a lot of times. Different people have different symptoms. So before you do anything, make sure you have enough information of what you're doing. Do not just see someone doing this and then you go to doing this, and see someone buy that drug and get that drug. Do not do this. A lot of times, another thing that the country is really pushing out for reduce the severe cases is to ask seniors to get vaccinated. Those elderly people who barely go out need to take it. Let's go to Dr. Tong. Do the elder people who barely go outside need to get vaccinated as well? Dr. Tong, can you hear us?
No, sorry, I can't hear.
Okay. Yeah. Absolutely. Let me repeat my question. We're talking about vaccination right now because the country is really pushing out vaccination, especially for elder folks. So a lot of older people, they don't go outside very often. Do they still need to get vaccinated? Dr. Tong?
Yeah. You said that the older people just don't go to.
Yeah.
Don't go to the hospital. Don't go outside. I'm sorry.
Vaccination. We're talking about
with my this one. Sorry.
Okay, we may have a little bit of technical problem there. So Dr. Tong may not clearly hear our question. All right, let's go to Dr. Ren first. So elder people, you have a lot of time you're dealing with older folks. A lot of the older folks may not go outside very often. Do they need to get vaccinated as well?
I believe so. I think the principles for the getting the vaccinated is if you don't have the contraindication, that you might need to get vaccinated. I knew that a lot of elderly person will think that, well, I often live by my own, right? I don't often keep in touch with others, but living alone doesn't mean that you're fully isolated from the surroundings, right? So there must be some social activity existing. And that's number one. Number two, that we knew, as Dr. Guo introduced to us, the Omicron, the variant is really spreading fast. And somehow the process for this kind of virus spreading is kind of insidious. I mean, it's kind of, you don't know when you got caught. So especially for the elderly person, it's better for you just to get a full vaccination. And it's better for yourself, and it's better for your family members. Especially, take myself, for example, if I have a grandma back at home, I would prefer she will get a full vaccinated so that I can, put myself, devoted all my time, energy, and work in the hospital instead of, worrying or concerning about her the physical status. So my answer would be definitely yes.
So especially when the Spring Festival is coming out and a lot of people may be traveling home. So during this time, the elderly folks who barely go out will still need to see their relatives, right? And those relatives are not living alone, or let's just say not going anywhere. They may carrying some certain virus, or this kind of virus may be COVID-19 virus or Omicron variant. We're talking about a large amount of people going to hospitals. We talked about for several weeks, or the weeks before, we've seen long lines in front of hospitals. Dr. Tong, can you hear us right now?
I know.
Okay, great. I know your hospital has been pushing online diagnose for some time now. Can you tell us how does that work, and how do you go to online and treat them?
Yes. The online hospital, yes. The online hospital has responded in the first time. And I think I remember in 2020, yes, just 3 years ago, our online hospital has opened a special epidemic area that all of the relative departments, doctors, like the respiratory department, the infection department, pediatrics, obstetrics, and our GP we will provide the 24-hour online consultation for patients at home and abroad. And we also have the psychological area. Yeah, that's all the psychological doctors will online to relieve the anxiety for the general public. And for the online hospital, we can do everything. Like our GP, our team, we can take the interpretation for the health checkup reports and make the online consultation and make a prescription and the telemedicine with other hospitals. And so for those patients with chronic diseases, especially they don't live in Hangzhou or live in Zhejiang, then they can use the online hospital, then dispense the medicine and the medication will be expressed to their home. And we also got a notice that next week, the online payment function of the medical insurance will be opened. So many of the chronic disease patients will take their medicines online, then they don't have to go to the hospital to take the medicine. So that's quite good for those people and quite good for our doctors, because we can see more patients with severe problems, and then it's not only just to take medicine for these chronic diseases. Yeah.
So do you do online diagnosis right now?
Yes.
Already?
Yes, because all of our GPs will online. We just take a schedule that's every day we will have 5 to 6 doctors online to deal with all the consultations for one day. Yeah.
So Dr. Ren, I bet you've been on the list as well. Now we've been talking about Spring Festival. So a lot of people may say, I got COVID like weeks ago. So right now my PCR test is negative and I don't feel anything. So do they still need to get protection measures during their traveling back home, Dr. Guo? Is it necessary? What is the possibility? I guess I don't want a number, but is the possibility big if they get reinfected with COVID, Dr. Guo?
Yes, as I've said, that we are talking about viruses. So just like everyone could catch cold or flu more than once, so the reinfection of COVID-19 is possible, of course, and the reason is that the protective immunity from the vaccination or a previous infection is not lasting forever, and the antibodies against the virus, against the coronavirus in your body will decrease with time. So you might catch COVID-19 again. And secondly, viruses are mutating all the time. Which can help them escape the immune system. Protection methods will always be important when you're going outside. And as I've said, the severity of the disease is associated with your immune system. So probably we should get a booster vaccination regularly in the future, like every year, just like the influenza shot. And secondly, the severity of this disease is associated with the viral loads. That means the amount of virus that you take into your lungs. By any chance, if you have got these protection methods, you should wear masks all the time to decrease the amount of virus that's going to your lung, and that might prevent severe cases.
Any other tips that you want to give to those who have already got COVID but want to travel to back home during the Spring Festival, Dr. Ren?
Well, actually, I think we've summarized a lot of very fundamental and important hygiene customers as well. So I think in short, we just briefly summarize, right? Wearing a facial mask and whenever possible, and just to constantly, for myself, constantly washing my hands, like the hand hygiene is very important. And just to make the plan, just to reduce the stay in a crowded activities. And the last but not least, as Dr. mentioned again and again, whenever needed, get a full package of vaccination. Yeah, that is my personal advices. And I do wish that everybody can have a really good Spring Festival holiday within a healthy status.
Actually, just weeks later. So that's why we're doing this live stream. We really want everybody to get notified before they travel out. Dr. Tong, do you have anything to add on? We've talked about what we should eat. You mentioned we need to eat high protein food like eggs, fish, right, milk. We've also talked about how you can't just go out and go to the gym and work out. You can't do that, but you need to maintain a moderate amount of exercise. Not exercise, I think movement. Like you can't just lay on a couch and be like a potato, right? You can't do that as well. And we talked about it's necessary still to wear a mask, even though you just got COVID. Any other tips?
Have a good sleep. Have a good sleep. Don't stay up too late. Especially in the Spring Festival holiday. Many many young people just see the just take our telephone and to see some movie or some TV or play some games, and they just stay up too late and not have a good sleep. It's really important to have a good sleep. That's our doctors want to have a good sleep, but we can't.
Yeah, I know.
Yeah.
You've been treating on site, as doctors mentioned. They've been, working endlessly. Some of them may be working 24 hours before coming to this live stream. Anyways, let's summarize what we talked about today. So we talked about how after COVID, you think that your PCR test is negative, but you're not fully healthy as normal, right? You still need to wear your mask, get very high protein food like milk, eggs and fish, and also you need to get enough rest. That is very important. Get enough sleep. Don't just play mahjong with your friends, and don't just looking at your phone watching TikTok or some other video games. Do not do that. Get enough sleep, and also make sure you get enough protective gears when traveling during the Spring Festival rush to protect people around you, people you care about. And I think all four of us want to wish you a very happy Spring Festival, although it's so weeks away, but we still want to say happy Spring Festival to all of our audience who are watching this. Make sure you get enough protective gears. That's something we want to say. And if you're feeling anything not uncomfortable, as we said, symptoms that are very severe compared to other people describe, go to see a doctor. And some things we talked about in this live stream, if your heartbeat beats too fast, Dr. Guo gave us math that we can just calculate from there. 220 minus your age, and then you times 50% or 70%. That's your normal heartbeat. If it's over this range, you might need to consider go find a doctor. And another way that you can find, you don't have to go to the hospital. Another way you can go is online, right? We're also pushing this kind of treatment online right now to save your time and also the doctor's time. All right, that's our live stream today. Very informative. I want to thank you so much, Dr. Tong, Dr. Ren, also Dr. Guo. Thank you so much again for taking your time, and it's been a great talk.
Yeah.
All right,
Thank you.
Anything else that finally you guys want to say to our audience in the end?
Stay positive, stay with science. Good luck, everyone.
Good luck, everyone. Dr. Goy, want to say anything?
Okay, just get prepared for the Spring Festival. Okay.
Get prepared for the Spring Festival. Very prepared. Make sure you wear your mask. And Dr. Tong?
Take care about yourself.
All right, thank you so much. That's our live stream today. Again, you're watching us live on CGTN. Make sure you join us in our future episode here on the chat room. I'm Li Zhao. It's been a great talk. Thank you so much, and bye for now. Thank you. Bye.
Bye.